Welcome to the Skinny Podcast, where we talk all things dermatology. I'm Carol Nicotero Ward.
And I'm Terry Rudd.
Let's start with a quick reminder. Our monthly podcast is available on iTunes for free. Just search for Skin and Allergy News. We hope you subscribe.
In this month's podcast, we'll bring you the top dermatology news and an in-depth look, or should we say biopsy, of the new Sunshine Act requirements. And stick around to the end because you won't want to miss Dr. Alan Rockoff's account of some unusual patient complaints. Here's Carol with the headlines.
A new report from government auditors shows that dermatologists may be profiting by referring pathology services to labs where they may have an ownership stake. The problem is that these types of self-referrals lead to excess treatments, and they are costing taxpayers big money, to the tune of $69 million in 2010 alone. The report has caught the attention of federal lawmakers who say they will consider policing self-referral to rein in spending.
In other policy news, the American Medical Association's House of Delegates had its meeting in Chicago last month. The group approved a policy that would let students bring sunscreen to school. Many states don't allow students to bring in over-the-counter medications without a doctor's note, including sunscreen. The new AMA policy makes clear that children should be able to apply and reapply sunscreen without restrictions.
And now some good news on fighting fungal infections in burn victims. Early research suggests that an encapsulated nanoparticle that was used as a topical treatment reduced fungal activity by 80 to 95%. Researchers are excited about the finding because nanotechnology could hold the key to keeping drug toxicity low. The study is published in the journal Nanomedicine.
Finally, an international panel is saying that patients with systemic sclerosis should undergo annual screening for pulmonary arterial hypertension. The panel also wants physicians to screen patients with mixed or other connective tissue diseases that have scleroderma features. Panel members said the goal behind the consensus-based guidelines is early detection.
Now it's time to go in depth on the Sunshine Act in our new segment, The Biopsy. Our reporter Alicia Alt spoke with Dr. Stephen Stone, who is the past president of the American Academy of Dermatology and is currently a member of the Committee on Regulatory Policies.
What are some of the key aspects of the Sunshine Act that dermatologists should be aware of?
The thing that really is going to impact on all of us as physicians is the gifts and entertainment, including food and beverages, and any travel we do, any charitable contributions they make. So if they give, for example, to a society we belong to that's a 501c3, that's a charitable organization, that will be reported as well. Everything else, royalties, investment interest, any kind of grants, whether it's for a CME certified program or a non-certified program. So it all gets reported with just a couple of exemptions, limited exemptions. If you get items of value of less than $10, I don't know, maybe a plastic ruler, they don't have to specifically report that unless over the course of a year it adds up to more than $100, and then they'd have to report even those little gifts. Product samples for patients do not have to be reported, nor does patient educational materials. Basically, loaner devices. So if you have an opportunity, for example, from a laser company, and you use a lot of lasers, if they let you use a laser on loan for 30 days to see whether you're interested in buying it, that would not have to be reported.
Now, the law says that manufacturers have to do this reporting to CMS. But would you recommend that dermatologists should keep track of their own gifts or honoraria, consulting fees, all of the things that are required to be reported?
Absolutely, because there's always the chance that they'll get it wrong. And since this information does become public, it's very important that dermatologists track this information and make sure that the payments are accurate. And it's not just for paying your own taxes, it's because this becomes public information. And I would recommend getting online periodically and checking to make sure that the data are correct.
It sounds like it's the kind of thing that could be very burdensome. Do you have anybody in your practice who you are designating to keep track of all of this? Or
No, I'm not. I don't think it's going to be burdensome, but it's not going to be that burdensome.
Well, you
It's
mentioned
certainly not going to be extremely burdensome.
You mentioned an area of concern, that in-office meal, which seems to be a pretty common practice. What can you tell dermatologists about what's going to be reported as far as these meals and what they should be concerned about or not concerned about?
Well, the food and drink is covered, so that the meals they bring into your office, unless they're less than $10 per person, not per meal, per person, and aggregated over the course of the year, $100 per person, they wouldn't have to be reportable.
Now, the idea behind the law is, as you said, to make everything more transparent for the public. Do you have a sense that the public is clamoring for this kind of data? Do your patients want to know what your conflicts are?
Actually, no. I sort of made it a habit for years that when I recommend a particular brand of shampoo, I might say, and by the way, I should tell you I have a conflict of interest. I've consulted for that company. And they are absolutely either bored to hear me say it or impressed that I'm actually consulting for a company that makes shampoos. But I really don't think the patient demand is as significant as is the demand from some consumer-oriented organizations and perhaps from some academic organizations that got caught up in this conflict of interest business.
Well, thank you very much.
The Centers for Medicare and Medicaid Services just released a free smartphone app to help doctors track payments they get from industry. There are also two other resources that you can check out. One is AAD's practice management website, and the other is CMS's Open Payments website.
And now, from his office in Brookline, Massachusetts, Dr. Alan Rockoff remembers being caught off guard by a patient's concerns about nitrogen.
I get occasional complaints, same as everybody else. Lately, though, I've gotten a couple that manage to surprise even an old trooper like me. My staff usually screens billing complaints, often from people who don't understand what a deductible is. But sometimes a complaint slips through to me. Last month, a patient actually walked into the office to dispute his outstanding balance. My secretary caught me between patients to ask me about it. "What's his problem?" I asked. "He says he shouldn't have to pay the bill," she said, "because his eczema came back." "Please tell him," I said, "that eczema comes back." He paid up. Then today, a long-standing patient whose facial spots I froze off came in for a follow-up. "The brown spots didn't go away," he said. "Sometimes we have to do it again," I explained. And then he came in from way out in left field. "Maybe it was a bad batch of nitrogen," he said. "Say what?" "Maybe the nitrogen was somehow off." "Are you serious?" I asked. "The good Lord made nitrogen. It can't be off." "Oh," he said, "I thought it was like some kind of compounded chemical that wasn't made up right, like the stuff they injected that gave people fungus infections in their spines." "No, sir," I said, "just nitrogen, compressed straight from the atmosphere. We're both breathing some right now." Then I froze him again, with the good nitrogen. This is Dr. Alan Rockoff. May all your gases be glorious.
That's it for us. We'd like to thank our reporter Alicia Alt and our producers Nassim Miller and Mary Ellen Schneider. This podcast comes together under the guidance of Skin and Allergy News Managing Editor Heidi Spleet. I'm Carol Nicotero Ward.
And I'm Terry Rudd. Don't forget to visit our website, skinandallergynews.com. And remember, you can subscribe to this podcast on iTunes for free. We'll be back with more news in August.